Thank you, Evert. Thank you also for the invitation to do this. Also from UV Medical. I'm not as a fast speaker as Claus, so I'll do my best to keep it in my 15 minutes to give some time. Now, when it comes to concussion management, I will talk a little bit about the assessment on pitch and also the return to play strategy a little bit more in detail than Claus already did, but he delivered a vast set of tools to do so. And if there's time left, a little bit about prevention, if it's possible anyway. Now, about the initial assessment. When it's looking like this, it's easy for us as team doctors or medical staff. You go into the pitch, and if people have posturing like the above picture or a vacant look, they are not right, then it's very easy. You don't have to do any test. It's obvious this is concussion, and they have to be taken off the pitch. So there are a lot of signs, and it's easy to see also from your video footage that could be very easy to determine whether it's a concussion or not. Now our challenge is when it's not that obvious. When people are reacting, they say, "Doc, I want to continue." The coaches, the manager is pushing in your neck, and they want to have a fast decision, perhaps even a referee, although we got your 3 minutes and it's not there. These are the most important decisions you have to make. And only afterwards, you were sure you made the right decision. But that makes it challenging and difficult. Now, I have a few lessons learned also for myself. This is from a case when he was hit by the goalkeeper with the elbow. There was no video footage available at that time. We talk about a few years ago now. We assessed the player initially. He was quite right, passed all the tests, but still after about 10 minutes, he got complaints of visual disturbances, double vision, fogginess, and we had to take him off the pitch. So, and it's a natural thing to happen. Sometimes you have this concussion and complaints and signs and symptoms, they develop over time. So one of the things you have to do, if you're suspicious, keep following your player. Even though you've cleared him, it might be still a concussion. Now about the 3 minutes, take your 3 minutes is possible because you need time. And sometimes there's a distracting wound of an eyebrow or the scalp, and you want to do the treatment of the wound. And sometimes you forget about the concussion. But the concussion is more important than the wound itself. Yeah. Although sometimes in the reaction of your players, you can already have a small hint if somebody is affected or not, that he has changed his behavior. One of the advantages of being a team physician, team doctor, is that you know the players. You know how to react in a natural way. So even small detailed differences, you can acknowledge and you can ask your players perhaps more thoroughly what's happening over there. Now, one of the things with concussion, what goes is there is a head injury. And a head injury might be accompanying a neck injury. Claus mentioned the Glasgow Coma Scale. I'm more a fan of the AFP because I'm not familiar with the Glasgow Coma Scale. I don't do it regularly. And for me, there's one issue. Is he alert or not? If he's not, he should be off the pitch. So that's an easy decision. If he's alert, he can help me, the player or she can help me, to determine whether the neck can be cleared. If there is no signs of any damage over there, just by palpating the material line, asking for a actively rotation for 50 degrees to the left or to the right, to check for focal neurological deficits. So it makes it easier for me to move afterwards. And they have cleared the neck, no issue. But if somebody is unconscious, it's almost impossible to clear the neck. So be aware of it. You have to do the extrication as if there is a neck injury. Now, Claus already told about all these symptoms possible there and signs. It's a very broad palette of all kinds of complaints, symptoms and signs. And it has also to do with the fact that in this lower parts of the brain, where the brainstem is situated and the midbrain, there are a lot of functions. And all those functions work together. So if one function is involved and affected, all the other ones will follow. So if you have only one symptom, for me, that's not a concussion. If you have only headache and the pain is on the site where he has been hit, probably it was just headache from the side where he was hit, and it's not necessarily a concussion. Usually what you'll see is that there are several signs, and there are a lot of them. Sleep you will not see for the initial assessment. Changed behavior you will notice, and look at the headaches, the visual problems, dizziness, balance problems. Those are the most obvious ones, and you can check it for yourself. Have your small list of things you want to check before you enter the pitch, and know that you have trained and acquainted them. So this is more my list, what I check. Yeah, and specifically ask for if you have any complaints. For the stability check, we do a lot of testing here also with athletes with long-standing injuries or long-standing complaints. And I think the tandem stance could be a very valuable test, or the tandem gait, just to check for very roughly for the stability. And the memory rhythmatics questions, they're all useful, but especially in the way your players answer these questions. Because I'm not sure if all my players know all the 5 answers on the questions before they even enter the pitch. So it's not a guarantee they know all the 5 of them. So beware of it as well. It's a pitfall sometimes. Now, about the return to play, it's already mentioned. A few things in advance. There's a small difference in the earlier versions and this new version, and that is that you're allowed in the first 3 stages to go to the next step with minor complaints. That's a difference. And the idea behind it is that it's very crucial and necessary that active athletes stay active as much as possible. It doesn't mean that you have to provoke complaints or make them worse, but a little complaint and also a small increase is allowed as long as it returns to a baseline or the complaints before exercising just in 2 or 3 hours. So just to make sure that they're not too inactive, because the inactiveness could also provoke complaints and make it even worse. From stage 4, you have to be free of complaints. No complaints at all. And that means that you need at least as a minimum 6 days to recover. And that is not unwise, because when you look at the brain tissue to recover, it usually will take about 7 to 10 days. Before that stage, you have this increased vulnerability. So if you start too early, either you will be hit and have a concussion earlier, or you have a prolonged recovery because you're not ready yet. And these 7 to 10 days might even be a little bit, too aggressive. So be careful with it, not to start too early, because everything could go well, but the brain tissue has not recovered enough yet. Now, the symptoms checklist, that's in the SCAT-6 now, you can use it as a tool for monitoring the systems. So you can have it on a daily basis, especially in the first stage, on a daily basis to monitor the complaints. One of the things that I think is still underestimated, and Claus also already mentioned as well, is the autonomic nerve system. So if you have players that have a raised heart rate, a resting heart rate, and they monitor them frequently themselves now, then that's an indication that your autonomic system is involved. It could affect your exercise and also other complaints. Now, what about the protocol itself before you start? It's just a protocol. It's not a law or something you have to do it. And there is some friction between protocol and practice. So don't get squeezed between them, but use your brains. Personalize it. Do what is available for you, and monitoring these daily symptoms, but use all these protocols as a starting point, as a basic, and you have to individualize it yourself. So this first step, don't take too much rest if it's not necessary. Everything that can do when the player can do without any complaints is allowed. A little bit careful with screens. But for the rest, everything is okay. And one important issue, I told you about the autonomic system, about heart rate, about the blood pressure and the ventilation, but also the stress system is located over there. And we have to be careful that we don't put too much fear already in the brain and in the mind of the player. Create a positive mindset. So concern is good, but don't exaggerate. Yeah? Avoid unnecessary stress about introducing long-term recovery and those kind of stuff, because it only introduces more stress in the system, and it will affect your recovery in a negative way. Now, this exercise-induced complaint. So when you start exercising and the exercise itself gives an increase in symptoms, it might be the vestibular-ocular dysfunction that's present. You can check it by your VAMS. You only need 2 fingers, a pencil, and a piece of paper. It's very easy. It takes you 5 minutes at the max, and it gives you some insight in what's wrong. Or is it okay? Then you go for, it might be the balance impairment. So it more that over there. You can check it as well. We use a fancy system, but as I told you earlier, it might be the best, or the tandem gait or the tandem stance. Simple balance test can already reveal some impairments over there. What I told you earlier about the autonomic dysfunction, the heart rate. Some athletes, as soon as they go over some kind of a threshold of an heart rate, will evoke complaints. Then you know that there might be a problem, especially when it's changing. So interval exercises will be an extra challenge for your system and might be provocative. And the last thing is the information processing dysfunction. You can do it by these computerized tests and measure it and assess it. But also you can do it and assess it by the small-sided games, because that is not only a dual task, it's more like a credible task. You do so many tasks at the same time that if it goes too fast for the player, he will notice, or his teammates will notice that he hasn't recovered yet completely. And don't forget about the neck. If people get, for example, a headache after training sessions, it might also be related to the neck. So check it as well. Yep. Now, so you have some simple tools for monitoring recovery. So use it. Symptoms checklist, the VAMS, balance test, and heart rate monitoring. They will support you in making the right decisions, and also to see what kind of systems could be involved and maybe get some extra attention. Now, we don't go specifically through all these in details through all these stages, but the first stage, after everything went well, there are no problems anymore, somebody's eager and ready to do some simple exercise, endurance exercise, cycling or just jogging, it's possible to do so. Yeah, preferably in a low stimulus environment, but that's something to do. The pitfall here is that they are too eager to start and are not ready yet. Another issue that you should start doing early in your protocol is use neuromuscular training. The risk of having a musculoskeletal injury in a year after a concussion has risen by 2 or 3 times. So it appears that this neuromuscular function is a little bit diminished or not as good as it was before the concussion. It makes you more prone for injury, so you could train it more than perhaps it was done before. Yeah, so that is something that you do in step 3. You might combine it with strength and conditioning, with strength training, but beware, strength training can give some kind of a Valsalva maneuver and could provoke, the little raises in blood pressure and provoke complaints in such a manner. But it's something you can choose to do. Now, step 4, this has to be symptom-free, because this is the start of the training sessions with the teammates. And be sure it is increased thinking. That is where the cognitive challenges come, coordination, high intensity. So these gradually increase, and beware of the Valsalva with strength training. But here it should be completely symptom-free. And most important stage now is step 5. If everything goes well, it's full contact practice. If heading is an issue because of fear, you can adapt and try to get the faith back by using simple exercises with a foam ball, just to see if everything is okay, because the technique in itself is very important. And return to play is a decision still made by the doctor, and by protecting health, it's a health issue. It's not a schedule issue. It's not because we have an important match the next day. It's because the player is ready. Now, about the prevention, headgear has been proven not to be effective. So if every time, when there's a concussion or there's somebody seriously injured, this discussion pops up again, but there has been some research already done, and because it's a rotational acceleration that gives the complaints and a concussion, you can imagine that this headgear is not effective. If somebody wants to use it because he feels more confident with it, go ahead. It's not a big issue, but it's not protecting against a concussion. What does, at least, adequate recovery after concussion, neuromuscular training to prevent musculoskeletal injuries, and strength training for the neck muscles. We think that bracing the neck could avoid these rotational forces more. So if you have strong neck muscles, that could help also prevent some of the concussions. And this is a little bit controversial, but it's my assumption, so it's not scientific, but it might be that if you are a good header, it might protect you a little bit against concussions. If you look at the origin of why players get concussed, for the females, most of the time, it's being shot by the ball. And for men, it's doing aerial duels, so the headers, so the contacts. Boys had more than girls, and men had more than women. And it might well be that this has an effect on your eye discipline. That if you are a good header and are adapted and acquainted to it, that you're familiar with it, that you can keep your eyes open for a longer period of time because you're not afraid. It makes you a better reaction for the ball when you head it, but also have the possibility to scan your surroundings, your environment, to see for the elbows and to check for the ball to approach you. So it might be a little bit of a preventive effect when you're a good header. So that is the key points for me now. Signs and symptoms. You want to check initially, know them before you enter the pitch. Be aware of the fact that symptoms may develop in time and that you have to follow your players. Prevent a too early return to play because you want to protect your player. You have to personalize the return to play protocol, and you have to create your positive mindset to avoid some negativism and also some stress in the system, which you want to avoid. That was it for me, Evert.